So Ebola is a filovirus, it's an RNA virus, first discovered in 1976 in the Democratic Republic of the Congo, DRC. And many of you will know one of the co-discoverers, Peter Piot, who is the director of the London School, a very eminent Belgian public health physician. And what we do know about this when it started in a convent actually was that the convent hospital was that the patients died very quickly and they had dreadful diarrhea, vomiting and bleeding. It didn't spread much because actually it consumed everyone who came in contact with it. And the scientists from the Antwerp School of Medicine, including Peter Piot, were alerted when they went out and they got a flask containing the blood of a nun who'd died. Clearly they must have used gloves or we wouldn't still have Peter Piot with us. And they found a virus unlike anything they'd seen before. We believe that this is transmitted from fruit bats who are asymptomatic. Indeed, they may have passed it to chimpanzees and dropped the population of chimpanzees as well. So people get infected through bushmeat. It's interesting, I've just 10 days ago been in Hong Kong and I was learning about SARS, which came from bats through civet cats into the markets and into humans, and was told that there are about 80 viruses in bats. So we're only seeing the beginning of what could happen. So what has happened in this particular outbreak? Well, it started, we now know, thanks to a nice piece of detective work published last December in the New England Journal of Medicine, probably in a village in East Guinea called Gwekadu. A young boy who called Emile, who probably got it from infected bats. So apparently in that village they used to play near a tree which bifurcated and the bats played in that bifurcation. And this child went and played there and eventually succumbed to it. And what you can see on this is how the disease spread. And it spread from this 2-year-old to her family, and then from her family into the health system, from one village to another, and through the health system. And it really did, on this occasion, spread. It spread, and that's because these borders are totally porous. It's less about nations and more about tribes, and many of you will understand this better than me. One of the areas that academia has been helping me with advice is Melissa Leach from Southampton, who's an anthropologist, worked for many years in Sierra Leone and understands about these tribes, understands about the interplay of culture and behaviour in this part of the world. So that's the first highlight I want to, well, it's not the first. I talked about academics making the diagnosis, finding the virus and underpin it. And now I'm talking about the role that academics have played in us understanding the flow across porous borders. There is a big role in global health security in these diseases, in antimicrobial resistance, for academics from all bits. It's not just basic science, it's behavioural science, it's anthropology, it's clinical science. We need rapid diagnostics. I could have talked about the Longitude Prize. That needs technology and engineering and design experts. We need people from every bit of academia, every bit of the universities to help. Communications, that takes you into, not just straightforward communications, but film, media. How can we recruit these people to help us do the best job possible? I don't think there's a single bit of the university that I couldn't find a role for in trying to solve these wicked problems and save people's lives. Thank you.